Hey everybody, Dr. Redcross here. Now, as you know, I have a lot of patients who are older. And my question to you and to them is, are you not getting enough sleep? Did you know that not getting enough sleep can actually lead to shrinkage in the brain and increase your risk for Alzheimer's? So why don't we take a moment here and let's see what the latest research says. So there's a few key takeaways that I want you to really listen up to. Number one, poor sleep actually accelerates brain shrinkage and increases areas in the brain that are linked to Alzheimer's disease. The other thing I want you to really focus on is slow wave or deep sleep and REM sleep are crucial. They help to clear the brain's toxins, consolidate memories, and process emotions. I also want you to recognize that the lack of deep sleep, the deep part that is so important to us, it leads to cognitive decline. Also neurodegeneration, especially in the inferior parietal sides of our brain region. The other thing I want you to recognize, and I'm talking to all of my patients out there, especially my older patients, older adults typically need less deep sleep, naturally. But make quality rest even more important as you age, regardless of that fact. The other thing to recognize is more sleep equals more deep sleep and REM sleep, but it must be uninterrupted to really and truly be effective. The other thing is some things that we can control: sleep hygiene, good sleep habits. What does that look like? Well, at least 7.5 to 8 hours of sleep each and every day around the same time, and just recognize that when you really get more sleep, it extends your life. Most studies show up to 5 years of extra life for men and 2.5 years for women. So what are some actionable steps that you can actually do today to get better sleep? That's what this is all about. Number one, I want you to stick to consistency when it comes to your sleep schedule. I try 10:30 each and every night. Not the best, but it works for me to have something to aim for. The second thing is avoid that screen. Avoid that computer screen and telephone screen before bed at least an hour, because that causes too much stimulation before bed. The other thing is I want you to create a nice, dark, and cool, quiet area for sleep. The studies show around 68 is the perfect temperature. We're all different, but shoot for it anyway and see how you sleep. The other thing is you gotta exercise regularly, but not too close to bedtime. I've learned that it gets me too wired up, and I don't want you to do that as well. The other thing is you got to manage the S word, which is stress. I don't like to say it, but you got to manage it and also limit your alcohol intake. So last but not least, the true bottom line is I need you to prioritize quality sleep now to protect your brain and health in the long run. Hey everybody, Dr. Ken Redcross here. If you don't know, I love the patient-doctor relationship. It is so important. So my question for you is, who wants to live longer? We all do, right? So therefore I've written 2 books. This first book is called Bond. It's the importance of trust, respect, empathy, and communication with your doctor, because I believe if the relationship is perfect, then it will help you live longer. But how can I really make sure you live longer? Well, I decided to write a second book. This is the 15-minute Bond Blueprint. This particular book helps you go minute by minute of your 15-minute visit to make sure you get the perfect doctor relationship and visit that you all deserve to make sure we extend our healthcare journey.